Dr. Petti, let's talk about headache, shoulder pain, neck pain, back pain even, and what that has to do with a dentist. Most of us would probably go, what? See, we keep looking always like where we have the pain, and we go, something is wrong there. So we go to chiropractors, and that's a good thing, by the way. I'm a believer in chiropractors. But apparently there's something missing why people get all those pains, and very few of them really looking into that area. Tell us what that is.
Well, a lot of things as far as the like headaches, jaw pain, neck pain, and even down to the shoulder pain has a lot to do with whether a person is, let's say, clenching or grinding at night and putting a lot of stress not only on their jaws, but putting stress on all of those muscles that go back to the vertebrae in the back of the neck. And if you start misaligning those, then yes, you will get pain down your neck. You will get pain down your shoulders. It's very, very related to things being out of kilter in the mouth.
So your jaws, that's what I call them here, your hinges here. So they're out of alignments. They don't fit for whatever reason. We may go to actually explain some of that. Sometimes it's missing teeth. Sometimes teeth grew wrong in the first place. Maybe you had a little car accident and everybody looks at the neck, but the jaws might have been out of alignment also. Whatever it may be. All of a sudden the jaw is linked to all muscles here, so you get all that pain, and a dentist can fix it. What is the average way how you fix it? What is it doing? You pull all the teeth out and put them back in, or what is it? What was the method of fixing it?
Well, usually, and let's just first go under the premise that the person doesn't have anything that's, that their teeth and gums are in pretty decent shape. Okay. So you're not having any bad infections and that sort of thing, whether in the teeth or the gum. And it's basically either a malalignment of the jaws, or they're clenching or grinding at night and putting a lot of stress on the jaws. Okay. So in my practice, if I find that they're, dentally, the teeth are fine, periodontally, the gum and bones are fine, but the person has headaches and they're waking up with headaches, we do a procedure we make what's called a night guard. And a night guard simply fits over either the top or the bottom teeth. And it keeps the person from biting down on the teeth themselves. So, A, it protects the teeth. B, it actually keeps some of the musculature in the jaws slightly open so that you're not cramping those muscles. And patients get a ton of relief from, properly done night guard when it's done under the right circumstances.
And by relief, you're talking headaches diminished greatly, shoulder pain, neck pain, and stuff like that?
Right, exactly.
I've heard from some dentists that if this condition has prevailed for a while already, whatever that may be, months, years, and finally the person goes to a dentist, or gets maybe sent to a dentist by a chiropractor or whatever. Either way, he ends up in a dental office, he gets it fixed, that quite often a dentist like you sends the person back to a chiropractor, massage therapist, acupuncture, maybe even a podiatrist to straighten out the rest of the body so that it doesn't get misaligned again. Is that does that hold true?
Absolutely true. In my practice, very many times I'll refer my patients to chiropractic therapy, and of course they have massage therapists in most of their practices. But good physical therapy, keeping the body in alignment, totally 100% key. If you don't do that, then of course it can go out. And it can actually precipitate from another source. Let's say you threw your shoulder out. You're working out too hard. You're doing pull-ups. You accidentally throw your shoulder out. Well, that starts to mess around with some of the vertebrae in the back. So the next thing you know, a domino effect. It goes up to the vertebrae in the back of your neck. Now it starts to throw in, and you'll get some pain in the jaw. And vice versa. Pains in the jaw can go down into the neck. So these guys are actually experts at making sure that things are properly aligned. And one of the things I like to liken it to is, you have a hose. You have water flowing through a hose. And you start to, crimp parts of the hose. Close off the hose. Well, you're not going to get a good flow of water in it. You're not going to get a good flow of energy and electricity and impulses to your muscles if they're cramped and they're shut off. So a lot of times, very many times, we'll have the patients go. I'll tell them, please check this out with some chiropractic therapy, some good physical therapy, and just make sure everything's aligned. And many examples of people coming in where they thought they had bad toothaches, where that actually occurred. So these guys play an important role in the whole healthcare, the overall healthcare industry.
Right. Well, with no doubt, what you just have demonstrated, at least in terms of warts, is we just can't escape to look at the whole body as a big, in a synergy and fix all kinds of things. And one thing out of alignment, yes, you fix it, but if at the same time you don't fix the other thing, it doesn't work. Like with a car, if your tires are all worn, you may replace them, but if you also don't replace your alignment, the tires will get out of alignment again, and they will be again getting all worn and stuff like that. All right. Well, so if people have headaches and they tried chiropractors and they tried things most of the time, unfortunately, they don't even try the chiropractor. It's quite amazing how few people try a chiropractor, actually. They try, what's that thing called? That new thing, aspirin, Tylenol, that stuff. Yeah. They just go on and on, with that stuff. They think that the body was born with a chemical deficiency somehow, and never fix the problem. Run around a little druggy. They don't know that. And of course, not that because you take a few aspirin, you become druggy right away, but you do that for a long time, and the body gets numb. So if a person has headaches and stuff, go to a dentist, check it out, maybe go to a chiropractor, try to go to both, depends on what. It doesn't really matter. A good chiropractor will send you to a dentist, a good dentist will send you to a chiropractor as needed. Am I right there?
Right. Absolutely. Absolutely.
Beautiful. Thanks for your informative session here. Bye-bye.
Okay, thanks, Helmut.